Hi, I'm Beverly, and my project is on histotechnology. I've worked in it since I was basically 17 years old. I have been registered since 1993, and I'm just going to explain to you a little bit about my field and what we do. I did describe it on the Google documents, but I will give you a brief overview. Basically, when a patient has surgery, let's just say they're going to go in and have a gallbladder removed. That is done in the OR. Then the gallbladder is actually removed by the surgeon and then is placed in a container of formalin. And this is taken to the laboratory, and the pathologist will actually take out the specimen out of the formalin and actually describe it. With this, he'll describe, like the shape, the size, the color, and any unusual formations, nodules, anything like that. And then once that is complete, he'll take a small sample of it and he'll put it into a cassette and then submit that overnight through a processing phase that actually removes water from the tissue itself. And at that point, we go in and we it'll basically just have paraffin infiltrating the tissue, and then we'll go in the next morning and take that same piece of tissue and embed it in something like candle wax. And then we can chill that down and then actually cut it into a very, very thin 4-micron section, and that's placed on a slide. And then the slide is basically stained first with an H&E stain, and then taken into the pathologist for evaluation. It's really, really a quick overview because there's a lot more to it. There's special stains. There's something called immunohistochemistry that's also a branch of histology. It's a very, very interesting field, and I think that if you know of anyone that's looking for a career but doesn't want to try a 4-year nursing degree type career, histology is a good option. It's a 2-year degree in associates, and that is offered at Tarleton State University. Dr. Toganoff is one of the professors, and he can help anybody that needs the help in that area. Let's see, and I also, in my document here, I included a kind of a panoramic picture of our laboratory. It's kind of small, but you can still see it. And then I also included some slides that I personally did when I took my test for histotechnology, and I have some brain here on the left, some fallopian tube, appendix, and some skin. And this here's just a basic H&E stain. There's nothing unique. It's a very routine stain, but basically the H stands for hematoxylin, is for the nuclei, and then the E is for eosin, and that stains for the cytoplasmic for the most part. But that's what the slides look like in the end, and that's what's given to the pathologist. And once the pathologist has reviewed and decide if it's normal, abnormal, whatever, they'll produce a written report that will go to the clinician, which would be your surgeon at that point, and he would be able to call you and let you know what your diagnosis is, and then you would decide at that point what would be the best treatment for you next. Alright, and that's pretty much it. Thanks. Oh, and at the end I did include a quiz here, but I'm not sure about that part. Thanks.